undergraduate and advanced nursing courses, including women's health and lactation nursing. Her current focus is in the field of emergency medicine, and she has worked at Tarim Emergency Medical Services for nearly 5 years. She was initially the director of the Women's Health Physician Assistant Program, and for the past 2 years has been serving as the regional director for all of Tarim for the Jerusalem area. Noah spends much of her time as an administrator, but continues to work in the field as a physician's assistant, as well as guest lecturing at the School of Nursing at Hebrew U. Additionally, Noah is currently studying for an MBA at Hebrew University in the field of biomedical innovation. So I'd like to welcome them both, and if you could both turn your cameras on and unmute yourselves, that would be great, so everybody else can see you. Awesome. So I want to start first with the impetus for both of your decisions to make Aliyah. Dr. Mayer, you know, we understand your father was a Holocaust survivor, and I'm curious how that impacted both your decision to study medicine and your decision to make Aliyah.
As far as studying medicine, growing up as a son of a nice Jewish couple in the Bronx and then Westchester, I was always told that I could be anything in the world that I wanted to be after I graduated medical school. But seriously, I did have a choice in the matter, and I think I've wanted to be a doctor since I emerged from my mother's womb. But I don't think that the Holocaust had an impact on that. As far as making Aliyah, a huge impact. You know, in addition to having a strong diaspora, we have to have a strong homeland, a strong country in Israel, because whenever there is anti-Semitism, and there always will be, or internal strife in France or in Ethiopia, or even in a place like America, it's important for people psychologically to know that there's a place for them in case things don't improve, in case they're feeling that they're under threat, that there's a danger. Now, in America, we don't feel that so much, or we didn't feel that, and I think my family who still lives in America doesn't feel that. But there are many places around the world where Israel is a security blanket. And the knowledge that no matter what happens, there will always be a country to take us in, when in the Holocaust, we weren't taken in by most of the countries. I think that's a crucial thing to sit in the back of people's minds, crucial. My father survived 5 camps, including Buchenwald and Auschwitz, and what he and my grandparents wouldn't have given to have had a place to go to, a place to stand up for them when it was needed.
Thank you. Noah, I understand you were on the very first Nefesh B'Nefesh charter flight. Could you describe a little bit about what that experience was like?
Sure. Unlike Guy, I didn't always know what I wanted to be when I grew up. So around the time of 9/11, I was actually in law school in Philadelphia. And I found myself really defending Israel a lot. And things were really bad here at the time, right? This was 2011, 2001, 2002, the height of the Intifada. And I actually came on a Birthright Trip for winter break. They were so desperate for attendees because everybody just kept canceling that even though I'd already been to Israel, they invited me to come on the trip. And when I came here, I just really felt at home. And it was a different kind of feeling. I had been spending so much time defending Israel. There weren't a lot of Jewish students where I was in law school. And I came here and I just felt comfortable. And I went back and I made an appointment with the Aliyah advisor in the local Jewish agency office. And he told me, you know, I just went to a conference for this new organization called Nefesh B'Nefesh. I have no idea if it's real. I don't know if anything is going to happen, but here's an application. And it was an amazing experience. We came, if you remember, 2002 was the height of the Intifada. Things were blowing up every day. And everybody on this plane really had this sense of belonging and this strong mission that we were going to really improve the face of Israel and cheer up the Israelis who had been through a terrible situation. And in fact, there's quite a lot of us are still friends from that original flight. We stayed in touch. And it was a really unique experience. We were the first group to ever do something this crazy. And people thought we were nuts everywhere we went. People recognized us. They would say, oh my God, you were the one on those flights. You're crazy. But it was a really special feeling, like we were all in this together. And it was a gift, really, to be on that first flight.
Well, I think it's a gift to be on any of those flights, but I can only imagine. So both of you are more so than the rest of us experiencing the COVID-19 crisis from the medical perspective. So Guy, you are the physician for one of the IDF's most elite commando units. Could you sort of share a snapshot of your day in that role and, give us a sense of how, that may have changed with respect to COVID and, and how this unit is functioning, who they are?
Yeah. I can tell you, I can't tell you everything, obviously, and I myself don't know 95% because who am I, a little Bronx kid? But I can tell you this, these are the elite of the elite, the cream of the crop. Getting into this unit is like making it into the Olympics, onto the Israeli Olympic team. And I, as a doctor, I had to pass a security clearance that took a year when I first made Aliyah, just to be allowed in and to be allowed to start there. It is a tremendous privilege to be able to help these soldiers because they are so important to the country. So if I can help in even a small way, keep them healthy, and they're generally healthy, let's face it, they're not coming to me kvetching about a lower back. In fact, it's the reverse. If they come to me at all, it's for me to say, listen, no, you can't do anything. You have to rest for 2 weeks because this is not good. You have a stress fracture or so on and so forth. So if I can help them just the smallest amount, then I'm helping one of the most important facets of Israel. And that is a unit which can go in and help in an acute situation or plan long-term missions. And I'm not a part of those missions. I like to tell that I have this fantasy that I'm going to be sitting in the clinic and they're about to go on some mission, which of course I know nothing about. And one guy is off on some other mission and the other doctor who's supposed to go with them breaks a leg getting into the helicopter and they go to me, Guy, because in my fantasy, they speak English, but with an Israeli accent. Guy, you have to come with us. I don't care if you have no training. You come with us into the helicopter right now. We go into Iraq or Iran. And I don't think that's ever going to happen. I know my wife did not like to hear about this fantasy. So it's not going to happen. But that's the kind of fantasy that nourishes me because just the dream of helping them beyond the mundane way that I help them throughout the day, whether it's back pain or an upper respiratory infection, or one of them got hit by a boulder in a training exercise. And also it's not only the combat, these commandos, it's also the entire support staff in the entire base. And we're all part of a family, and everybody is doing his or her part to keep this machine well-oiled and functioning perfectly. And so my tiny part in it, to me, is very important. And I never could have imagined when I was a doctor in Brooklyn, to Israel and having the kind of a position that I've been in for the past 15, 16 years. So thank God, even if what I do is typically mundane, it is not for a mundane unit. It is for the tip of the spear.
So you could tell us more, but then you'd have to kill us?
I'd have to kill everybody tuning in to this. I don't even know if I could reach out and find everyone.
Yep. Noah, as a nurse and a medical director at Terem, which is fairly, for people who don't know, a very prominent ER center in Jerusalem, I understand you've sort of been in the thick of things as the COVID pandemic has evolved. Could you talk a little bit about some of your experiences? Because, you know, I think it's important for people to understand how it's impacting, you know,
Sure.
medical professionals.
So just two little corrections. One, I'm not the medical director. The medical director is somebody named David Zlotnick, who is actually also a Nefesh B'Nefesh Olim, came a few, I think about 6 years after me. I'm the regional director. And Terem has clinics from Nahariya all the way down to Eilat. We're not just Jerusalem based. I'm Jerusalem based, but we actually have branches all over the country. So there have been basically three main things I would say I've been involved in personally. The first is right as the cases started coming. The first big hotspot actually was the very neighborhood where my office is, where our main flagship branch is. So very early on, I would start getting calls in the middle of the night sometimes from the Ministry of Health saying there was a patient in your clinic at this time, this day, and please help us locate everybody who's been exposed. And I would have to just drop everything and go straight to, I'm able to access all the cameras for all of our clinics on my laptop. So it didn't matter if we were in the middle of Friday night Shabbat dinner, which happened, or I'm also doing a graduate degree. Sometimes I'd be in the middle of class on one laptop and have to go to my other one and start doing epidemiology on cases. Then Terem started getting far more involved in terms of the COVID landscape. The first was we started working with one of the major Kupot Cholim, Leumit, and Terem became responsible for all of the testing of patients who were in home, we call it ishpuz bayit, like they were, instead of being in the hospital, they were in their houses. These were patients who were sick, but well enough that they could be at home. So I personally actually was one of those people that suited up in hazmat suits and driving around the country to little towns all over the place and going into people's homes and taking those nasal swabs that you see people doing. And Terem did that for the whole country. People who were in their homes for this specific healthcare fund, Leumit, we would go do that. And I did that many, many times until my children actually started getting really scared. And I kept having to show them, but look, mommy's dressed in a full hazmat suit and nothing is getting past this and it's totally fine. And the third thing that we've been doing that we're still doing is, I don't know if you've heard, but Israel, we have these Corona hotels, we call them, okay? Any travelers who arrive until a couple days ago had to be quarantined for 2 weeks in a hotel. And if patients were from an area with a really high density of patients, or they were unable to quarantine themselves away from their family or quarantine themselves in a way that was safe and kept their neighbors safe and their family safe, they would go to these hotels. And it was a brilliant idea because the hotels are sitting empty. There's no tourism right now, no tourists at all. And so this gave the hotels sort of a little bit of a business, and the army was actually running the hotels. So Terem provided all the medical care. So we're still doing it. Our doctors and nurses and physician's assistants go into the hotels and check the patients. Some of them are sick with things that are completely unrelated to COVID-19. We had a patient, for example, who was newly diagnosed with diabetes while in the Corona hotel that we diagnosed. We've had heavily pregnant patients. I have no idea how they end up in these Corona hotels. Heavily pregnant patients who are like on the verge of labor, and we've got to like make the decision on get them out, because getting them out is also at a cost. The hospital has to clear out an area, a special ambulance has to come take them. So we're still doing that. And so I do that. We suit up, we go into the hotels, we check the patients. And we've also developed another good way of doing it is the doctor suits up and goes in, and the physician's assistant stays out. And so I've been doing that a lot, and I'm in an earpiece. The doctor has a stethoscope in one ear and an earpiece in another connected to the physician's assistant. And we're basically writing up the entire chart, writing the prescriptions. If anything needs to get done, it's like Mission Impossible, right? You have somebody on the outside, somebody on the inside. So we're doing that, and it's an excellent system because it's able to minimize the amount of time the doctor has to be suited up in the hotel. He can see 12 patients in an hour, hour and a half, because he doesn't have to do any of the writing, any of the charts, anything like that. So it's really hot in those suits and really uncomfortable and a little bit scary to be in these hotels. So where every single person has corona. So so that's my day-to-day right now.
Kol hakavod. I give you a lot of credit. It's important and it's inspiring. So Guy, you worked as a physician in New York and now 17 years in the IDF, and as a community physician. What can you share as a doctor for the people who are tuning in today about Israel's response to COVID?
Well, there's the national level and there's the individual level of where I work. We'll start with the individual level. Where I work, I split my time between this elite unit and Maccabi Health Fund, Kupat Cholim Maccabi. And our approach is very systematic, with a lot of dialogue between Misad B'Riyut, the health ministry, and the doctors and the nurses and the people in the lab and so on and so forth. We know what we have to do, and when someone comes in and sits down, as of now, and things change, it's so dynamic with treating patients. As of now, I'm still having my patients sit 2 meters away from me, and we both put on masks. Now, there's no foolproof way of not getting infected, and there's still that danger, but we're minimizing the danger as much as we can. And I'm not overly concerned with that kind of interaction. I think there's more of a danger just going somewhere, going into the supermarket and coming upon somebody who is selfishly not wearing a mask, let's say. Same thing in the Army. The Army, I sit the Chayal or Chayelet 6 feet away from me. We use our masks. When I need to examine them, I examine them obviously with gloves. And they understand and I understand, and we work together to try to prevent the spread. Now, when it was first going on, and even now, but certainly when it was first going on back in those early days, the policy was if somebody in the unit got sick, they were sent home, sent away from the unit, because the last thing we needed in that unit was for the unit to be completely shut down. To have corona sweeping through it would have been devastating for the country, potentially. And so we were very, very aggressive in sending people home whenever they came in complaining of something. And very few people selfishly took advantage of that and made up symptoms. Most people were trying to stay on, but where possible, we sent people home, be it an entire subunit of Chayalim to keep them fresh and safe at home, or one of the doctors to keep them safe and ready for a potential mission that might pop up. And what's special about my Army unit is that they feel a social obligation to the rest of the country. They're constantly doing projects where they fan out across the country and help out with underserviced populations, underprivileged people who need help. They're doing that throughout the years, nothing to do with Corona. So now during Corona, what they did was they fanned out to all the various hospitals and tried to use their innovative genius to try to come up with a better way of wearing the mask, a better way of putting on a robe, that kind of thing. And not only the doctors fanned out and the medics fanned out, but also anybody who had some kind of a skill went and tried to donate his time to a certain hospital and try to help out. As far as Maccabi is concerned, it's the same idea. We are a community within Maccabi. Maccabi is a wonderful health fund. And every step of the way, we've felt Maccabi had our backs and been treating the patients, and not felt that we're dealing with an unknown any more than anybody else can feel like it's an unknown. Back early on in the middle of March, I was exposed to a corona patient, and so I was put into quarantine for a week and a half, because it was another few days after when they finally found out that the patient had coronavirus. So then it was another week and a half to complete a 2-week quarantine period for me. And then when I went back, I went right back to work. And while I was at home, I was able to see people digitally. I was able to handle digital requests. Maccabi set it up so that I could work from home and help people out. If it came to needing to be seen, then my partner was at Maccabi, and she was able to see the patient. If the person really needed to be seen, I couldn't handle it virtually. But if not, they made available all the doctors that we could send prescriptions to people who needed it, and send referrals, and set things up for patients, and also answer questions, as well as what's called a bikur telefoni. Instead of coming for a frontal visit in the Maccabi offices, people were able to schedule a 15-minute block of time where I would sit and answer questions and help out the patient with whatever he was worried about, be it concerning corona or not concerning corona. So all of these things were made very, very available, very streamlined, and wonderful. And then finally, I'll just end this answer with my answer about the country as a whole. The country as a whole has been wonderful. There's a reason why we've been able to limit the corona cases and limit the mortality from those corona cases. People have been, for the most part, very, very good at following the advice and recommendations of the health ministry. And people have come together and made sure that the spread was minimized as much as possible. You can't eliminate it altogether. You can't just lock people in their houses and not allow anybody to leave for 3 months. So people did have to come out, but you do what you can. And this country did what it could. The health ministry was wonderful. My next door neighbor is a prominent infectious disease specialist, and he's been working with the health ministry and giving advice. And it has been wonderful what we've been able to accomplish in this little country. And I'm so proud of Israel.
You'd be surprised to know that New Yorkers are actually staying inside, which I never thought would happen. But
good.
But Noah, you know, we're hopefully you guys are a little bit ahead of us in terms of edging toward the end of this crisis. But there is talk about a potential second wave. Can you talk a little bit about, you know, how you're preparing for that and what you think the response could be if it happens?
Sure. Firstly, I think our overall response as a country just really highlights the value that we place on life. Guy touched on his personal reasons for Aliyah having to do with the Holocaust. And this idea that Israel was created, I don't want to say on the back of the Holocaust, but with the Holocaust in our minds, really, you see it in so many aspects. For example, we don't really have DNRs in Israel. There's a lot of things that are different about our healthcare system that really highlight the value of life. And I think our response to the COVID-19 crisis really highlighted that. We locked down pretty firmly. As Guy said, people were, for the most part, really respectful. Even communities that I know got a lot of bad rap. I personally was going into the very Haredi communities around Israel, and I was really impressed by the way that they were really doing their best to follow the instructions. Now, in terms of a second wave, I don't even like to use that word, because I think COVID-19 is going to be part of our lives for a while. I think while we were, we were using this term a lot, flattening the curve, right? We wanted to flatten the curve. So what was the idea to flatten the curve? Was to keep the curve under this red line, which was the medical system's capability. So during those 5-6 weeks that Israel was really locked down and we were flattening the curve, the medical system was raising its red line, okay? So that whenever this second wave comes, and it will come and it will be part of our lives, our capabilities are so much better now than they were 2.5 months ago. When I think about when I was first getting these phone calls in the middle of Friday night dinner, how disastrous, you know, everything was just like on the fly. We would change our instructions every 6 hours. It was really hard to deal with. And now I think we really managed to get the medical system to a place where we can handle more sick people, unfortunately. For example, this past week, any nurse who wanted could get trained in the use of a ventilator, so that when the next round comes and they need extra nurses to use ventilators, we already know how. Any nurse who wanted to was given the opportunity to get special ventilator training now, when we don't need it, when there aren't that many patients who are on ventilators, which is a brilliant way of thinking forward for the future. And I think people are going to continue to get sick, and our hope is just that nobody's going to pass away from COVID-19 because the medical system failed them. People are going to pass away. I hope it continues at the very small rate of Israel. But I think we're in a situation where it's not going to be the fault of the medical system if somebody doesn't survive.
Let's hope.
Yeah.
So last, and I want to end on sort of an up note. You're both sort of examples of what Nefesh B'Nefesh does in terms of bringing medical professionals to Israel. We've brought over 650 doctors and medical professionals since 2002. Can you share with us how you feel the medical Olim have affected the Israeli medical system? And you can both chime in.
Sure. I would say it's a symbiotic relationship. Let's start with what I can do for the country. So first of all, there's a physician shortage here in Israel. The big Russian wave from the 90s, many doctors, they're all retired or nearing retirement age. And there are not enough doctors. Surprisingly enough, it's a Jewish country with, everybody's a Jewish mother here. You would think that everybody would be a doctor. There aren't enough medical schools. And if the medical schools would graduate more, there aren't enough places in hospitals to place all of these newly graduated residents. And so too many doctors have to leave the country. Too many college students have to leave the country to go to a medical school in Europe or in some other place. And so there aren't enough doctors here right now. So there is simply a quantitative need for physicians. We need more. There aren't enough. And there is also a qualitative need. I think that, obviously I'm generalizing, but I think that American doctors, but Americans in general make Aliyah, they bring a certain compassion, a certain politeness, a certain approach that maybe could rub off on some more brusque Israeli doctors, shall we say. I think that we bring something to the table. I don't think that should be dismissed, although obviously, again, there are a million compassionate Israeli doctors. God forbid I should disparage them. They're wonderful. But I do think that there's a certain American ethos to sitting and listening to patients and being patient with them and being very polite and attentive that we bring here. But aside from that, I am living the dream. This is helping me. This is for me. This is not only what I can do for my country, this is also what my country did for me. What my country is doing for me is I have gone from practicing in Brooklyn, which was great, and living in America, which is a great country, and took in my father after the Holocaust. And I have nothing but praise for America, but I'm in my homeland. And I am a community doctor in Modi'in, treating patients here, and I can bump into them in the mall. That vision of the doctor carrying his bag and walking around and seeing people that he knows and giving advice, that was always my dream about becoming a doctor. That was my dream. And I'm getting to live it here in Modi'in. And being a part of the Israeli army is something that's beyond a dream. I was never even able to dream it. I couldn't have dreamed it. I wouldn't have imagined that something like this was possible. And so whatever I'm able to bring to this country as an idealistic, compassionate American doctor, well-trained Albert Einstein in New York, far more they are doing for me, this country is doing for me. And thank God for JNF and Nefesh B'Nefesh for helping us make something that we wanted to do. Some of us wanted to do all of our lives. Some of us wanted to do at the last moment. But thank God we have the ability to do that. Thank God we're getting that help, so that I owe a lot specifically to Nefesh B'Nefesh and JNF. And whatever I can do to put into the system and help out here and try to make this country the better place, because Israel is the homeland of the Jews. If I can make this country a better place, then that is my dream. And you guys are enabling me to live that dream. So thank you.
Well, it's our privilege. And you're doing, I say this frequently about, you know, some of our partners. You're doing the hard work building Israel. We're doing the easy stuff, raising the money. Noah, yes, but still a little easier. Noah, I just want to get your thoughts before we wrap up.
Sure. Well, first of all, I work for an organization called Terem, and Terem was founded by an American Ole, by Dr. David Applebaum. I'm sure many of you have heard this story. And Dr. Applebaum was an American-trained ER doctor who saw the crowding in the Israeli ER system. And he said, this can be better. I can do something better. So he brought the model of urgent care, but he sort of amped it up on speed. Our urgent care clinics are a lot more advanced than urgent care in the United States. And we all know that Dr. Applebaum passed away in 2003. He was a victim of terror. He was killed along with his daughter the night before her wedding. And his mission is something that really drives our work every day in our clinic. Terem, for example, has been one of the pioneers in bringing physician's assistants to Israel. PAs do not exist anywhere else really in Israel. And Terem has been fighting with the Ministry of Health for 10 years. And we train them ourselves. We have a PA school. We use physician's assistants. And I see Sandra here is asking about advanced practice nurses. So there's a nurse named Karen Andrews, also American, who has been fighting the good fight to open up advanced practice nursing in Israel. I mentioned that I'm doing an MBA in the field of medical technology. And so many companies are run by American or Anglo, I would say, immigrants who are really bringing the best of our country, of America, to the Israeli healthcare system. And even just like last week, I had a lecture by Dr. Ron Ellis, who's like a pioneer in the field of vaccines for Merck, American, Jewish guy, lives here in Israel. And I think so many Olim, like medical professionals, come and they look at the Israeli system, which is a fabulous system. I'm a big fan of the Israeli healthcare system. I think it's much better than the US one in terms of our accessibility, and everybody has access to healthcare, which is something really, really critical. But we come and we look at the system and we say, how can we make it better? What can we bring from our home country that's really successful there and apply it to Israel? And if 20, 25 years ago, there was very much this mentality of, we say, Ze ma sheyesh v'im ze nenatzeach, right? This is what we have and we'll just make it happen. And that was the Israeli mentality of, well, this is our healthcare system, like it or leave it. We're not making changes, it works for us. And now there's a lot more openness to taking these wonderful aspects of the American healthcare system, like advanced practice nurses or physician's assistants, and applying it to the Israeli system. And it's always Olim leading the way in these things. And I think we're doing good to the medical system here.
I want to thank you both very much, both for making Aliyah and you know, continuing to build the land of Israel, but also for joining us today and supporting Nefesh B'Nefesh. We really appreciate your time. And with that, I'm going to turn this over to Ron Werner to wrap us up.
Greetings, everyone. My name is Ron Werner, which I guess you just got from Debbie. I serve as a vice president on the Jewish National Fund National Board. I am president of JNF's Must High School in Israel, and I have the great honor of serving as the chairman of JNF's Nefesh B'Nefesh Task Force. We have a really cool task force, as I think you realize today, and we're always open to new people joining us. I want to thank the hundreds of people who joined us. I'd like to thank Deb, who took the time to moderate and ask some really interesting questions today. A very special thank you to Guy and Noah for sharing the stories. It's really simple. You just heard the case today for Nefesh B'Nefesh and what we call Aliyah 2.0. We are no longer Olim who are refugees. We are Olim of choice, moving freely to the land of Israel, building modern day Israel. And that's what Noah and Guy are so integral in doing today. Nefesh figured out some time ago that there was a shortage of doctors in Israel, which I know Guy mentioned, and it is counterintuitive that the Jewish state doesn't have enough doctors. It's also the fact. Nefesh figured this out, and they took on the task of infusing doctors and nurses and medical professionals to Israel. Nefesh has brought over 630 physicians who are great Zionists. They left well-paying jobs in America. They were upwardly mobile. They came to Israel by choice, Aliyah of choice, Aliyah 2.0, and they're building families and communities. They learned the language, they went through the cultural barriers, and they're making a difference. They are modern day Zionists. They are our modern day pioneers building Israel, and they're doing so with the support and the backing of Nefesh. Our Olim reside in 183 communities throughout Israel. Our doctors and our nurses can be found in nearly every hospital and department. They really are Israel's frontier. We need to continue this vital work supported by Nefesh. It's key to the sustainability of the land of Israel. It's key to the safety of the Jewish people. Every single doctor and every single nurse who comes is a gift that we can barely quantify. You just think about how many people they touch in a day, how many people they touch in a week, how many lives they make better, dedicating their skill set in the land of Israel for Israel and the Jewish people. Our Olim doctors and nurses are the gift that keeps giving. It keeps Israel strong, it keeps Israel safe. This is core to our Zionist mission. I want to ask you if you'll make a gift to support Nefesh B'Nefesh, if when you make your next gift to JNF, if you'll consider allocating that gift to Nefesh B'Nefesh. The dollars are needed now more than ever. Because of the coronavirus and how it's affected economies, the government of Israel, the Jewish Agency, and Kakal are all reducing funding. That hurts Nefesh. Nefesh is losing dollars from its key supporters at a time when demand for Aliyah is up 83%. Year over year, we are seeing 83% more applicants coming to Israel. Why? Because as we all have sat home for the last 2 months, we all have been evaluating what matters in life, what's important. And people are waking up, realizing what Guy said, living the dream. A Jew being able to freely move to Eretz Israel and live the dream that's been building in our DNA for 2,000 years, since the destruction of the temple in the year 70 and our exodus in the beginning of the diaspora. Today, any Jew can come back to the land of Israel as a citizen, build a life, and build the state. This is done through Nefesh. We're seeing numbers now, and we believe in the next 18 months, 100,000 people will want to move to Israel. It's not free. We need your help. We'd love you to consider joining our task force. We'd love you to help supporting Nefesh B'Nefesh. You can do so online right now. You can visit my.jnf.org/Nefesh. my.jnf.org/Nefesh. Thank you so much. These stories are inspiring. They're what motivate people like me on the task force to spend more time working for the land of Israel than I actually do in my business, and it's really fulfilling. Come with us. Let's help fulfill the dream. Let's help build a strong, safe Eretz Israel. Have a great day, And we hope to see you next week for our last part in the four-part series where you can experience virtual Aliyah. We're going to give you the taste and the flavor of what it's like to be an Olet or an Olah making Aliyah, moving to the land of Israel. Thank you so much, everyone.